Vaccination.
Awesome. Nice to meet you.
I haven't been here in a while.
Oh, thanks for coming.
Yeah.
I used to work with a lot of your colleagues in DC. I worked at the White House before this.
Oh, really?
And we worked with Kemp a lot. Yeah.
Oh, okay.
Yes. Good people.
Yeah, so I'm basically like I'm with the local one, plus
Okay.
if they need every time they need something national from Georgia, so
That's
so,
cool.
so nice meeting you.
That's awesome. Nice to meet you. My name's Mallory.
Nice meeting you.
Nice to meet you.
All right, well, good afternoon, everyone. Let me thank you, as always, for joining us for this update. I got several different topics for you today. I certainly want to thank Dr. Toomey and Director Stallings for being here to provide updates, and they'll be able to answer any questions as well. I also want to let you know that General John King's here. I want to thank our Insurance and Fire Safety Commissioner for what he's been doing on many fronts, but especially with messaging to the minority communities across the state on vaccine hesitancy. I wanted to first provide a brief update on state revenues for the month of February. We'll be releasing those totals later today. Given the delayed tax filings and then corresponding delayed tax refunds, this monthly report will show an abnormally large increase in year-over-year net revenues to the state. This is certainly great news overall. State revenues continue to be strong in the face of a global pandemic, thanks to our measured steps to get Georgia businesses and families safely back to normal. But given the unprecedented and unpredictable nature of a global pandemic, federal aid, tax refunds, unemployment payments, and a host of other issues that can potentially impact the state budget, there is still a lot of uncertainty when it comes to state revenues through the end of this fiscal year and into next. My office is continuing to work closely with our budget team, the state economist, the House and Senate budget offices, and others to proactively plan for the future and ensure that Georgia's financial footing remains on solid ground. As the best state for business and a state with a AAA bond rating, creating new jobs and spurring economic opportunity will always be a top priority for this administration. I certainly wish it was a priority for the Biden administration and the Democrats in Washington, D.C. The $1.9 trillion blue state bailout being rammed through Congress without bipartisan support, like the previous aid packages, would slap Georgia with one of the biggest decreases in funding when compared to formulas used for the CARES Act. It also significantly singles out many conservative states to specifically prevent any of us from using these federal funds to pass tax reform. You heard that correctly. Democrats in Washington, D.C. are now telling states that they cannot cut their taxes, create new incentives to attract investment, or expand or incentivize school choice. But bloated spending, special pork projects, a long list of other things, as well as bailing out the states who poorly manage their economies, are all fine by Washington standards. Georgia's business climate has consistently been ranked among the best in the country, even during the pandemic. And that ranking isn't just on paper. It means that businesses know they can create jobs in Georgia thanks to a stable, welcoming business environment, world-class logistics network, and a workforce that is second to none. This bill represents everything that is wrong in Washington, D.C. and with the United States Congress. Instead of using the bipartisan blueprint of previous federal coronavirus relief bills, this legislation is literally a wish list for California and New York. And quite honestly, it's a slap in the face to my fellow Georgians. Democrats in Washington and in the White House are not going to tell me or the Georgia General Assembly that we can't cut taxes for hard-working Georgians. I'll continue fighting to put Georgia families and businesses ahead of partisan politics, and I sincerely hope that our Democratic representatives in Congress will work to make significant changes to this bill while there is still time. On the COVID-19 front, our data continues to drastically improve. During the worst days of the winter surge, over 30% of our hospital census were COVID-19 patients, around 5,700 Georgians in the hospital. Today, that number is 1,523 patients, around 10% of our census. Our 7-day average of new cases is the lowest since early November, and our percent positive test is at its lowest level since October. And thankfully, we are now seeing deaths continue to decline. This data is very clear. Every metric on the COVID-19 pandemic is headed in the right direction. We have made significant progress without a statewide mask mandate. The people of Georgia did this without shutting down restaurants or bars or closing churches or houses of worship. Georgians stepped up and did the right thing. The people of our state are resilient, and they have proven that over the last year. And as we've said many times before, people, not the government, would stop this virus. Georgia has been open, and Georgia will continue to be open because we are a state that values both the lives and livelihoods of all our citizens. When it comes to vaccine distribution and administration, we continue to make significant progress in vaccinating our most vulnerable Georgians. With 77% of our COVID deaths occurring in those over the age of 65, we focused on providing access to the limited supply of the vaccine to these high-risk Georgians. That approach has led Georgia to beat the national average in vaccinating seniors, with nearly 2/3 of our total senior population receiving at least one dose. With increased supply on the horizon, we worked quickly with Georgia Emergency Management and Homeland Security Agency to stand up 4 initial mass vaccination sites and announced last week that an additional 5 sites would go live a week from today. We also expanded vaccine criteria beginning this week in order to protect more high-risk Georgians and get our citizens back to normal. To ensure that we stay ahead of the increasing vaccine supply and any lagging demand among currently eligible Georgians, on March 15th, we will be expanding vaccination criteria further to include all Georgians over the age of 55 and those with high-risk conditions defined by the CDC. Dr. Toomey will cover these conditions during her update here in just a few minutes. But again, the criteria will open up on March 15th to Georgians over the age of 55 and those with high-risk conditions as defined by the CDC. Adding these additional high-risk Georgians will mean that vaccination will be available to categories that have accounted for 92% of our deaths due to COVID-19 in Georgia. As we have from the beginning, we will protect the most vulnerable to severe illness, hospitalization, or death, and enable Georgians to get back to normal. Provided we continue to see increasing vaccine supply, it is our intent to open up vaccination to all adults the first part of next month. For everyone currently eligible, I want to urge you to please make your appointment as soon as possible. The Department of Public Health's website has a vaccine provider locator tool, as well as a scheduling website for public health districts at dph.georgia.gov. You can also register for the soon-to-be 9 state-operated mass vaccination sites at myvaccinegeorgia.com. And with well over 2,000 private providers, including Kroger, Publix, Walmart, Ingles, Walgreens, CVS, and others, we will continue to encourage all eligible Georgians not to wait to get their dose. This vaccine, as we've said many times, it is safe, it's effective, and is our ticket back to normal. The more Georgians who choose to roll up their sleeve, the quicker we will get to that point. Over the weekend, following her second vaccine dose, I was able to give my mom a long-deserved, long overdue hug for the first time in over a year. It was a reminder of what we all have ahead of us as we continue to move through this process and get us back to a normal way of life. I am convinced that we will get there. I'm convinced that we're going to get there sooner rather than later if we continue to get shots in arms and if we continue to do all the things that have gotten us here over this past year. Thank you very much, and with that, I'll turn it over to Dr. Toomey for her update.
Thanks so much. It's really good to be here today to talk about the exciting things that are happening in the vaccination program, and that we are opening up to additional eligibility individuals, as the governor said, over age 55, but also those adults 16 up through adulthood who have multiple health conditions that may put them at risk for complications of COVID. And this is something that was very, very important, I think, for us to do, is we've taken an approach of trying to prevent as many deaths and as many hospitalizations as possible in the way we've rolled out this vaccine. Those individuals who have, although they may be younger, who do have these health conditions may end up with more complications from COVID. And I just wanted to go over some of these conditions so that you know the breadth of the eligibility that we're now going to be prioritizing in the vaccination program as we beginning next week. So asthma, particularly severe asthma, all cancer and those who are being treated for cancer, cerebrovascular disease, so that's that affects the blood vessels in your brain and the blood supply to the brain, so that you may you've had a stroke or some other neurologic problems, and neurological conditions such as ALS, chronic kidney disease, chronic obstructive pulmonary disease or other lung diseases, cystic fibrosis, multiple sclerosis, diabetes, hypertension or high blood pressure, and other heart conditions, including heart failure, coronary artery disease, cardiomyopathies. These are all things that affect the heart, but also can lead to complications from COVID. Immunocompromised states, so again, individuals with HIV, for example, will be eligible now. Liver disease, neurological conditions such as dementia, Alzheimer's, again, at higher risk for complications. Overweight and obesity, that is one of the greatest risk factors in childhood as well as adulthood for complications of COVID. Pulmonary fibrosis or lung scarring, which could be caused by any number of factors. Sickle cell disease, which affects a large number of people here in Georgia. And thalassemia, another type of blood disorder. So you see, it's very broad. The breadth of now eligibility has really grown considerably, and I think many Georgians, 16 through adulthood, now will be eligible, and I think that's a very positive development for us. I think that it will be very important to continue to reinforce the eligibility, but also to remind everyone that although Pfizer can be used for individuals 16 and 17, so those are both those with developmental disabilities as well as some of these other conditions, Pfizer is not available at every vaccination site. And so if you were trying, either a parent with a child who needs to be vaccinated, or you yourself need to be vaccinated, or vaccinate a family member of that age, it's important that you register ahead of time and look on our website, where we will list those sites that have exclusively the Pfizer vaccine or have it available, so you can be sure to get vaccinated with the right vaccine. And all of our sites that GEMA is currently operating exclusively use the Pfizer vaccine. I also wanted to just talk very briefly about the really important partnerships that we've been able to develop. We've been working with Walgreens to partner to be able to increase vaccination for people living with intellectual disabilities and their caregivers. And Walgreens has stepped up to the plate to be able to help us with these vaccinations, because many of these young people may feel uncomfortable in some of the other vaccination settings. And we're actually piloting over the next 2 weeks throughout Georgia to encourage these clients to go to a Walgreens site and to really have that special TLC for that vaccination program. We're going to have one open in Athens and a number of other special locations. We again will post these on our website so that you'll know. We are also, even as we're moving into these other categories, are continuing our partnership with the areas on aging and the aging advocates who are helping us with a remarkable number of individuals that we were not able to make an appointment or were not able to be transported without assistance to our sites. That will continue, and that partnership, which was only developed in the last several weeks because of the need to identify these individuals at risk and be able to transport them, has already paid remarkable dividends and will continue to do so as we think about moving in even on beyond COVID and for next year's flu season, for example. And in many cases, the AAAs had not even known the health directors and vice versa. And so now we have established a very effective collaboration throughout. This is all over the state, not just here in Atlanta, that will allow us to do our work better. I think the final thing I just wanted to say is that we continue to monitor very closely the variants that are actually, we see a considerable number of variants throughout the state, and particularly the UK variant. We now have 3 of the
All right, sorry about that. All right, now I'm going to get Director Chris Stallings from the Georgia Emergency Management Homeland Security Agency to come up and give you an update on our vaccination sites. Before Chris comes up, I just want to personally thank not only him, but his whole team. And I've been able to thankfully visit some of these sites. We got some hard-working Georgians on the ground, not only from GEMA, but FEMA, local health department, local law enforcement, state law enforcement, our National Guard. It has truly been a federal, state, local partnership, and I just want to thank Chris and the whole team, and he'll give you an update.
Thank you, Governor. Just for a quick update, our vaccination sites continue to deliver thousands of vaccinations every day across Georgia. To date, we've given 43,146 shots, and our 5 new sites will begin Wednesday of next week, expanding our capacity to an additional 38,800 first shot doses. 3 of our new sites will have appointments available on Saturday, so we're trying to reach that time frame. We understand our teachers aren't necessarily off during the work week, so we're trying to accommodate some of them as well. Our vaccine allocation, as it increases, we will continue to evaluate our current sites and to ensure that we're operating in a way that maximizes our capacity and our efficiency. As far as the rollout that the governor discussed today, if you're over the age of 55 and you had pre-registered at myvaccinegeorgia.com, you're automatically going to be enrolled forward, so there'll be no reason for you to follow up. You'll immediately receive an email that lets you know to go to the registration process for your appointment. So if you've already pre-registered and you're over 55, due to some of the changes that we have to do on the website, due to the new age requirements and the 16 that's not been eligible before, our website has got to take a little change on that. So anybody who would be registering for the new ones, that registration will begin Monday morning at 6 a.m. So if you're over 55, you'll be eligible to change your registration immediately. You'll get notified. But those that are 16 and above with the new registration, that'll be Monday morning at 6 a.m. As the governor mentioned, our 5 new sites, if you're around the state right now and you're seeing stuff set up, that's because we're working and getting ready. Those who are under 55, again, make sure you select which category you're under. We're not, trying to single you out. It just helps us better serve you when you're on our sites. As far as that goes, Governor, that's our updates, and I'll be open for any questions anybody might have.
All right, we got questions. Yep.
Governor, should I go? Hi, Governor. Rafael from Univision. We've seen the effort that you guys with Commissioner King have done to impact the Hispanic community. It's been hard hit by the virus. One thing I wanted to ask you guys is that we want to measure the success you guys have had, but when we take a look at the website, still the amount that when we go to the ethnicity, the amount of people vaccinated, the ethnicity, the vast majority of it is still unknown, so we still do not know exactly how many Hispanics have been vaccinated. And I was wondering if there's any plan for you guys to kind of change that or fix that. And the other thing is I want you guys to please reiterate the message to private providers, because we've had many people trying to get the vaccine to a Walgreens or other places. They told them, oh, you don't have a Georgia driver's license, you cannot get the vaccine. But we have been able to fix that. They've changed, but I also want you guys to reiterate that you don't need a Georgia driver's license to get a vaccine.
Okay.
Thank you.
Well, I'll let, if anybody wants to speak to the website issue. I know early on we're going to catch a lot of those, regardless of what ethnicity they are, on the second dose. And I know we are continuing to message to private providers and all of our partners. I'll let General King and perhaps Dr. Toomey speak to that.
Thank you.
Just several things. One is that we recognize that we haven't been able to collect that data adequately because it was not initially not required in grids. We fixed that. We've sent messages out to all providers to remind them that this is a mandatory a data point that they have to report, and when we are going back into reminding them and even retroactively trying to fill that in. So that's very, very important. And we've also emphasized to providers there is no need to show a driver's license. You don't need a social security number, and not just here for the vaccination, but also for testing, because our testing is ongoing, and we have to continue to reinforce that because it's important we continue to test even as we're doing the vaccination. We are working with the Latin American Association and many other Hispanic chamber, as I'm sure you're aware, and they're doing some special vaccination events, which I think will help, but also we need to keep reinforcing to providers and to be able to report that data adequately. The other thing, we should be seeing more and more because we've been vaccinating older adults, and a lot of our Latinx population are significantly younger here in Georgia, and I think you'll be seeing also those numbers increase as well.
Thank you so much.
¿Quieres que hable en español o en inglés?
En español, muchísimo mejor.
Ok, lo hacemos muy bien en inglés. There's a test for the rest of y'all here so you can keep up. So our interpreters can interpret in Spanish too, so they're superstars, by the way. Mira, el mensaje que hemos mandado es bien claro, que estamos tratando de que la comunidad venga a tomarse la vacuna. Y a propósito, no hemos preguntado muchas preguntas, porque queremos que la gente tenga confianza. Tu estación tuvo la oportunidad de ver uno de los, y es importantísimo, y te agradecemos mucho a ti y a tu compañía, que tuvo el tour para poder describir cómo está el proceso de tomar la vacuna. Y muchísimas gracias a tu canal, porque es importante el mensaje que estás pasando. Pero a propósito, no hemos preguntado muchas preguntas porque queremos que la gente tenga confianza, que vamos a pedir información mínima. En caso de que haya un problema, podemos ponernos en contacto con la persona para que regrese a tomarse cualquier tratamiento. Pero estamos tratando que la gente tenga confianza, que no vamos a preguntar preguntas que no sean médicamente necesarias. Eso es a propósito. Y sabemos que el problema es que tomar las estadísticas de cuántos hispanos han aparecido es difícil cuando estamos preguntando preguntas muy menores.
Entendido. Gracias, comisionado.
He'll tell you what I just said. No. On purpose, we have designed, especially our engagement with the Latino community, is to not ask a whole lot of questions, because we want to encourage folks to come to these sites, take advantage of the vaccine, and make them feel comfortable. I was thanking his channel, because they came and did a tour recently, and they described the process of how to get a vaccine. So what we're trying to do is inspire confidence in the Latino community, who is very sensitive of being asked a number of questions about their identity, because we want to encourage people to take advantage of the vaccine.
Thank you, Commissioner.
Thank you, General. Anybody else?
So question's going to be for Dr. Toomey, and also if you want to chime in too, Governor. Dr. Toomey, I've been talking to superintendents at local districts, especially rural districts, and the numbers they're giving me when they survey their teachers is about 50 to 60% of teachers are saying they're going to get the vaccine. They were hoping for higher, but that's kind of the number I keep hearing from district after district. In a classroom, what is that going to look like? Is a lot of the protections and masks and acrylic glass going to still have to be up if you're only getting 50 to 60% of staff? And then how do you address, again, some districts are doing education for teachers to get them to take the vaccine. How do you address, what does that look like in the classroom, and how do you get those numbers up?
No, thank you, because this is something we know about. I mean, vaccine hesitancy, whether it's in teachers or through others, in other populations throughout the state, is something that we really feel is our top priority to try to address. And I think that we all recognize that not everybody is willing to get vaccinated right now, and that we need to keep making that available even as we move forward. And we hope we can do that as quickly as possible so we can get the state back to where we need to be pre-COVID. However, just being vaccinated doesn't mean the school is safe. It means that teachers are protected from infection, but not 100% protected, but the children still may be able to develop COVID, and those unvaccinated workers can still transmit COVID. And so we've always said, and I think if you look at the CDC guidelines, being vaccinated doesn't mean you don't have to continue to practice those mitigation measures in the school. Some distancing, masking, and ensuring that the children and the teachers and the other staff have access to hand washing, all those things. It's just hard to have that many people in a small space indoors. But increasing ventilation, simply opening the windows and doors can provide enough ventilation that helps reduce COVID transmission. But the other thing we've also seen is that, particularly in the case of teachers, transmission that occurred wasn't in the school itself or in the classroom, was in the break room where they were interacting with other teachers, or even at home on the weekends. And so clearly vaccination will help, but it won't fully prevent transmission in the schools. And we're hoping that we can continue to reinforce the messaging about taking precautions, even as we encourage more and more teachers to be vaccinated.
But just a quick follow-up. If you're only looking at half of teachers and staff getting vaccinated, can classrooms return to normal, for example, in the fall?
Classrooms can return to normal without vaccines because the CDC has clearly said that the mitigation measures are highly effective if followed consistently.
Let me just follow up on a couple of things. I mean, number one, we know that it is safe for kids to be in the classroom right now, and it was safe for them to be in the classroom before we started the vaccine administration here in Georgia. And many of our schools have done that. I applaud them for making those tough choices and sticking with it. And for those that have started to go back or are fixing to go back, you know, I want to continue to urge them to do so. We'll try to be helpful if there's any way that we can from the state perspective. But know this, you know, the original survey that we got on teachers is we were thinking there was only going to be about 45% of the teacher population were going to take the vaccine. So that is good news that number is a little bit higher from your calculations. I think it'll continue to get better as more teachers get vaccinated. I know from my experience seeing teachers getting vaccinated at the Gwinnett site earlier this week, also seeing what's on social media of our educators and others that are posting, and they're so relieved and excited to be getting their vaccine. I think that will help spur the demand with our educators, not only teachers, but anybody that's working in the school to help protect them. But make no mistake, this is your opportunity these days ahead to get in the queue and to go get your vaccine, because we are going to open this up to 55 and older and these medically fragile individuals that Dr. Toomey spoke about. And when that happens, there's going to be that increase of demand out there in regards to our limited supply. I personally feel like we're getting to the point where Dr. Toomey and I are going to be moving very quickly if the data moves quickly. And that is what's driving our decisions. But if we see that we need to move quicker than we are because the demand starts to drop or the supply increases, we're going to be prepared to do that. We are doing that right now with this criteria on Monday, and that is an exciting thing for our state. But I would urge you, if you're in this new category that will start on Monday, you should sign up today or tomorrow, or as soon as you can become eligible for those 16-plus-year-olds that are medically fragile on Monday morning at 6 o'clock and get in the queue, because this is going to move rapidly, especially in certain parts of our state, and what we want is for people to get vaccinated. I will be getting my vaccine. I have been waiting for this day. I'm sure that the First Lady will be doing that as well. As far as I know, I'm going to be taking the Johnson & Johnson dose. I'm ready to be one and done. I also think it will help show people that the J&J dose is effective to preventing serious illness and hospitalizations, and it's a very effective vaccine. So I hope that will help with messaging and give my fellow Georgians further confidence in the process. You know, when exactly I'm going to do that, we're still working through that. But I'm looking forward to that day and grateful to be eligible like the others that are in our state. Richard.
And Governor, I wanted to maybe clarify what you had said earlier. You're hoping by next month, maybe early next month, to open it up to everyone. And what kind of criteria are you looking at? And also, as a follow-up, do we know how many vaccines we are getting per week now?
Well, the vaccine supply is something that we're still watching and working on, but you know we have a lot of good things going on in our state with the mass vaccination sites. We know that our private sector partners have access to the vaccine. We know that our hospitals and medical facilities have access to the vaccine, so we're very confident in how we're moving forward. Now again, we'll move and change if we need to. We don't want to create such demand that we have you know, the horror stories that we saw in other states of long lines. We want to continue to work to prevent that by doing appointments, but we also don't want to have supply sitting out there with not having the demand for that supply. And the tricky thing that we're dealing with in that regards is we have, you know, as you can imagine, tremendous demand in the metro Atlanta area, but our rural communities, we've seen that some of these populations are starting to get saturated with the number of people that want to get the vaccine versus those that are still eligible in that community that just are not electing to get it. And, you know, it is your choice as a Georgian, but we are not waiting anymore. As soon as we start seeing availability, we're going to move quickly to open classes. I think, you know, looking at open it further in the first part of April, the discussions that I'm having in my mind as critical infrastructure employees and employers. You think about food service industry, those that are in the ag. I've talked to Commissioner Black about this. There's other critical areas, our front-facing, you know, individuals that have been on the front lines, quite honestly, the whole pandemic. You know, people like grocery store, convenience store clerks, and others. We want to move to that population as quickly as we can and try to protect them and continue to keep our economy going. And all of this gets us back to normal. All of this builds consumer confidence that will help our economic rebound in areas that hasn't been as robust as some of our state because of just consumer confidence, basically, like tourism. I mean, we're moving into a huge part of our spring and summer tourism industry in Georgia. I want that to be robust. I want people to come to our state and to vacation and to spend money, and I want them to get, you know, the individuals that are here, I want them to be vaccinated so they feel comfortable hugging their mother or taking her out to dinner or taking their family out. And let's continue to move down the right path. And we're going to continue doing all those things, but we got to do several other things in conjunction with that. If you're not vaccinated, continue to follow the guidance, continue to follow the criteria and the regulations that we have out there. But then if you're in these criteria, go ahead and sign up, get in the queue, and try to get your vaccine before this demand increases again here on Monday.
Governor, we're hearing that there's enough vaccines at Georgia Tech right now to vaccinate all of their faculty, but they haven't distributed them because...
I'm sorry, I'm having a hard time hearing you.
We're hearing that there's enough vaccines at Georgia Tech right now to vaccinate all of the faculty, but that they haven't distributed them yet because they're not considered eligible. Is there any truth to that?
I wouldn't be able to speak to Georgia Tech having a surplus of vaccine. That would be problematic in my eyes if there's vaccine that they're holding. That is not what people need to be doing. We don't need to be holding vaccines. We need to be giving shots to those that are eligible. But I have not heard that.
And one more follow-up. Is there any update on expanding vaccine access to rural areas as far as mobile units?
Well, look, we had a mobile unit here at the Capitol today. I know that's something that public health, our local public health departments and others are already planning for, obviously, as we move into the other criteria. I mean, mass vaccination sites are great. They're working very well. They're very efficient. People can drive through those literally in 3 to 5 minutes in most cases. Then you have your 10 to 15 minute or so waiting period after that. But I know that folks at the local level, our private sector partners and others, including us, are already starting to think about that mobile vaccination van, vehicle, whatever it is, that literally can go neighborhood to neighborhood, church to church, civic club to civic club, or what have you. And I don't know if y'all want to add anything further to that, but that is something that has been in the works for quite a while.
Governor, DPH numbers continue to show more than 800,000 doses that have been shipped but not administered, which is roughly 3 weeks supply at last week's pace. I know we've talked about that before, but how should we be thinking about those numbers currently? Are those vaccines really in a freezer somewhere in Georgia?
Well, I think there's a lot of different numbers, a lot of different factors that are contributing to that number. I don't necessarily believe that number. We always have vaccine that's in transit that we're being the websites are saying we've been accredited for that vaccine because they're being shipped to our state, but we haven't physically put our hands on it and been able to get it out to sites to get shots in arms. We do know that we have hospitals and others that have supply that they have been holding for second doses. We do know that because of the weather event several weeks ago in Texas, we had this, anomaly in the graphs of we got an oversupply 1 week because we didn't have an undersupply the last week, and then the demand obviously went down because we didn't have that supply. Now we have an increased supply, so we got a little bit of catch up to do on that. I really feel like with the expanded criteria, with our teachers getting vaccinated now, we're going to be able to continue to get where we need to be. The other thing is, even though we gave some school systems a 10-day heads up, we have some of them that have elected to wait to get their teachers vaccinated. So that's contributing to it as well. All right, thank you. I'm sorry.
Yes, Governor, I was wondering if you all have an estimate of how many additional people will be added to this expanded vaccination list, and then also for the issue regarding the demand in Metro Atlanta, what additional measures are being considered to get more shots in arms for those people, for people in this region, and once you're trying to expand it in early April to all adults?
The first question you were just asking about the number of people.
Yes.
Well, the answer to that question is as many as we need, we're going to get them. I've just met with General Cardin earlier today. The Georgia National Guard stands on high alert and ready to go for any site. They've been at the mass vaccination sites we got. They're going to be at the new ones, and we're going to continue to deploy them to help with logistics. But I don't think Georgians need to worry about us having personnel to give shots or to do the logistics at our mass vaccination sites. And I know our folks on the ground in public health and everywhere else are working hard. Just speaking to the Metro Atlanta issue, obviously our demand continues to be high here. We are continuing to focus on this area. We're working with the feds on the Mercedes-Benz site as well as with Fulton County. We have the mass vaccination site at Delta. I was at the Gwinnett site the other day. We've got the site that's not too far out of the metro area up in Habersham. We're going to be opening one in Cartersville. And it's our intention to continue to work on those issues to make sure that we have the available supply as we get it in, where the demand is. And we know that's here and that's where we're targeting. I don't know if Chris, you want to add anything to that?
We've also made the decision to expand the Delta site. We are going to have a little more allocation there in the Pfizer. So currently we're operating at a maximum of around 2,200 a day. The goal is to roll it up to 4,000 a day starting in the coming month.
And I think that's a good point and a good thing to kind of finish with that question with. Every site that I've been to, all everybody needs to do is add another lane, or two, and they can double the amount of vaccines. It doesn't matter whether it's in Macon, at the Delta site up in Habersham County. They were saying the same thing. At the Gwinnett site that I went to, that's obviously the case in Albany and Southwest Georgia, and we'll continue to do that, whether it's in Sandersville. I mean, the good news is in places like Athens and Augusta, they continue. We're not putting mass vaccination sites there because they're handling the demand. I mean, what AU and our medical professionals and pharmacists and other people are doing in those areas has just been unbelievable. So we don't want to stand up another site. We'll just continue to send them more of the supply as we get it. So that, people are going to have that access as we continue to get the supply. All right, thank you, everyone.
The by millions kind of thing?
Yeah.
Okay, yeah. Let me, my understanding, I think the number I heard yesterday was something like 2.5 million or something like that. But let me get the specific. Okay, let's hear it. It's a lot though. It's a lot of people. Hopefully. Yes. Yes. That's easy.
Yeah, that's what I was trying to ask.
I got you.
Okay, thanks. Yes.